Your dog is scratching, and that jar of coconut oil on your counter looks like an easy fix. But before you rub it on red skin, listen carefully. Coconut oil may help dry flaky patches, yet on wet, smelly, infected skin, it can trap heat, yeast, dirt, and bacteria. I'm Dr. Thomas Lee, and today I'll show you when coconut oil can soothe itching, when it can make things worse, and how to use it safely. Comment dry if your dog's skin looks flaky, or smelly if the itch has odor, moisture, or redness. This matters today, before rubbing anything. In my clinic, I often meet tired owners who have tried shampoos, sprays, wipes, pills, and another expensive bottle from the pet store. Their dog still scratches at night, chews the paws, rubs the face on the carpet, or licks one spot until the hair starts to thin. That can make any caring pet parent feel guilty, because you're watching a family member feel miserable and you don't know which answer is safe. Coconut oil becomes tempting because it feels gentle. It is in the kitchen, it smells clean, it sounds natural. And for some dogs, on the right kind of skin, it may help soften dryness and reduce that rough, flaky feeling on the coat or paws. The fatty texture can act like a light barrier, almost like a skin conditioner, when the area is not broken, not wet, and not infected. But here is where many owners get into trouble. Itching is not always dryness. Sometimes the skin is angry because yeast is growing. Sometimes bacteria are involved. Sometimes fleas started the problem and the dog scratched until the skin opened. Sometimes allergies made the belly red and now the surface is warm, moist, and irritated. If you put coconut oil over that kind of skin, you may cover the problem instead of calming it. Think of it like putting a blanket over a damp towel. The towel does not dry faster. It stays warm and wet. Dog skin can do something similar. If the area already smells bad, feels sticky, looks shiny, oozes, bleeds, has swelling, or hurts when touched, coconut oil is not the first step. That dog needs a proper skin check, because trapped moisture can make yeast and bacteria more comfortable. Also remember that licking changes the picture. Many dogs enjoy the taste of coconut oil, so they may lick the area more after you apply it. More licking means more moisture, more friction, and sometimes more redness. If your dog turns the spot into a snack, the oil is no longer soothing. It is inviting another irritation cycle. That is why a tiny test area matters before covering a larger patch. Watch your dog for a few hours, not just a few minutes, because skin reactions and licking patterns can show up later. I don't call coconut oil magic. I call it a tool. A tool can help when used in the right place, in the right amount, at the right time. It can also make the job harder when used on the wrong skin. Your first practical insight is simple. Before reaching for the jar, look at the skin like a vet would. Is it dry and flaky or wet and smelly? Is it mild or spreading? Is your dog comfortable or acting painful and restless? That one check changes everything. Because if the skin is only dry, we can talk about a careful coconut oil routine. But if the skin smells yeasty or looks infected, the safest move is completely different. Now stay with me because this is the part that saves many dogs from the wrong home remedy. The question is not, is coconut oil good or bad? The better question is, what kind of itch is my dog showing today? If you want calm, safe dog care explained by a veterinarian, subscribe to Dr. Thomas Lee. I'll keep these natural remedies practical, careful, and easy to understand, so you can help your dog without guessing. Here is the safest way to think about coconut oil. It may be useful for small, dry areas, rough elbows, mild, flaky skin, or a paw pad that feels a little dry but is not cracked open. In that situation, you are not trying to cure a disease. You are only supporting the skin barrier and adding gentle moisture from the outside. Use a very small amount. For a small dog, think less than a pea-sized dab for one small patch. For a medium or large dog, you still do not need much. Rub it between your fingers first, then apply a thin shine, not a greasy layer. If the fur looks soaked, you use too much. The skin should be able to breathe. After applying it, watch 3 things. Does your dog lick it non-stop? Does the skin look redder after a few hours? Does the area become warmer, wetter, or smellier the next day? If yes, stop. Wash gently with dog-safe shampoo or lukewarm water if needed, and call your veterinarian if the irritation continues. Please do not put coconut oil inside the ear canal. A smelly ear, dark discharge, head shaking, or painful ear can mean infection, yeast, mites, allergy, or another medical problem. Oil in the canal can make the ear feel worse and delay real treatment. Also be careful with dogs who have pancreatitis, a fat-sensitive stomach, or a history of vomiting or diarrhea after rich foods. Some owners add coconut oil to the bowl, but eaten oil is fat. It can upset sensitive dogs. If your dog has had pancreatitis, don't feed coconut oil unless your vet approves. One more thing. Never mix coconut oil with random essential oils for itching. Many essential oils are too strong for dogs, and cats in the home can be even more sensitive. Natural does not always mean safe. For itchy skin, plain and simple is better than powerful and risky. When the skin is already stressed, fewer ingredients often protect your dog better than a complicated recipe. Here is a simple home test. Use it only on one small dry spot for one day. Do not use it on wet, raw, bleeding, swollen, oozing, or smelly skin. If the spot improves and your dog leaves it alone, you may have found a helpful support. But now, if coconut oil is only safe for dry skin, what should you safely do when the itch comes with odor, redness, or hot spots? That is where the real vet warning begins for worried owners. Here is the biggest aha I want every dog owner to understand. Coconut oil does not fix the root cause of itching. It may soften dry skin, but it does not kill every yeast problem, remove fleas, stop ticks, heal deep hot spots, or solve food allergies. If we pretend it does, the dog keeps suffering while the real trigger grows. So use a simple decision routine. Step 1. Look. Dry flakes, rough coat, and no bad smell may allow a tiny coconut oil test. Wetness, odor, pus, bleeding, swelling, heat, or spreading redness means stop and call your vet. Step 2. Think about location. A dry elbow is different from a wet paw crease. A flaky back is different from a red belly rash. A paw that smells like corn chips and is licked all night may involve yeast, allergy, or moisture between the toes. Coconut oil on that paw can make the space even greasier and more attractive for licking. Step 3. Protect from the inside out. If your dog has repeated itching, the answer is often a routine, not one jar. The bowl matters. Some dogs need better omega-3 support from vet-approved fish oil or safe sardines in water. Some need plain pumpkin for stool support. Some need a plain probiotic food only if they tolerate it and it has no xylitol or birch sugar. Some need flea control, allergy testing, medicated shampoo, or infection treatment. I want you to picture two dogs. Dog 1 has a small dry patch on the hip, no smell, no wound, and normal energy. A tiny coconut oil dab may help comfort that area while you watch closely. Dog 2 has red paws, a strong corn chip smell, brown ear discharge, and licking until midnight. That dog does not need more oil first. That dog needs a root cause check. For hot spots, be extra careful. A hot spot can spread quickly because licking and chewing keep the skin wet. It may look small in the morning and much larger by night. Thick fur can hide the damage underneath. If the area is painful, warm, wet, or has a sharp smell, do not seal it with oil. Your vet may need to clip, clean, and treat it properly. The best daily formula is boring, but it works better than panic. Check the skin. Keep damp areas dry. Bathe only with dog-safe products. Wash bedding. Watch for fleas or ticks. Introduce foods slowly. Use coconut oil only as a thin support for mild dryness. Stop if licking increases. And please don't let social media push you into rubbing oil over every rash. Your dog's skin is a living barrier. When it is dry, gentle moisture may help. When it is infected, trapped, or inflamed, covering it can delay care. That is why the strongest daily remedy is not coconut oil by itself. It is knowing when the jar belongs on the shelf and when your dog needs a real, safe medical care plan. Let's bring this home in a way you can use today. Coconut oil is not the villain, and it is not the miracle. It is a small skin support tool for the right situation. Use it only when the skin is mildly dry, not broken, not infected, not painful, and not wet. Start with a tiny amount on one small area. Wait and watch. If your dog licks more, scratches more, smells worse, or looks redder, stop. Your dog is giving you information. Do not apply coconut oil to open wounds, bleeding skin, pus, deep hot spots, wet yeast areas, severe ear infections, painful swollen skin, or any rash that is spreading. Do not use it to replace flea control, tick removal, allergy care, infection treatment, or a vet exam. This is not about replacing your vet. It is about knowing what is safe to try at home and what needs medical care. Call your veterinarian if you see a bad smell, swelling, discharge, fever, hair loss, spreading redness, strong pain, constant licking, open sores, bleeding, weakness, loss of appetite, vomiting, diarrhea after new food, or any sudden change that worries you. Also call if your dog has deeply attached ticks, suspected poisoning, seizures, trouble breathing, or a hot spot that grows quickly. For dogs who can tolerate it, the better long-term plan is gentle and steady. Keep the skin clean and dry. Use dog-safe shampoo when needed. Check paws after walks. Control fleas and ticks safely. Feed a balanced diet. Ask your vet about omega-3 support if itching keeps returning. Keep notes about what makes the itch worse. Meals, grass, baths, weather, treats, bedding, or seasons. And if you want to use coconut oil in the bowl, slow down. A little fat can upset some dogs. Dogs with pancreatitis or fat-sensitive stomachs should avoid eating coconut oil unless a veterinarian approves. Small dogs need much smaller amounts than large dogs. More is not better. A calm routine also protects your wallet. When you use the right home support early, you may prevent mild dryness from becoming a bigger licking habit. When you recognize infection signs early, you avoid wasting days on the wrong remedy. That balance is the heart of vet-informed natural care. Not fear, not blind trust, just careful observation and quick action when the skin tells you something is wrong. I know this can feel frustrating. You want to help quickly because you love your dog. You hear scratching at night and your heart sinks. But careful care is still loving care. Sometimes the kindest thing is not adding another remedy. Sometimes it is stopping, looking closely, and choosing the safer path. So remember the rule. Dry and mild may be a tiny test. Wet, smelly, painful, swollen, bleeding, or spreading means stop and call your vet. Once you see that difference, coconut oil becomes less confusing, and your dog gets a much better chance at comfort, sleep, healing, and safer relief tonight at home with more confidence. Before you rub coconut oil on your dog, remember the simple rule. Dry and mild may help, wet and smelly needs a vet. One mistake can keep the itch going. Comment your dog's main skin problem: dry flakes, paw licking, hot spots, or bad smell. I'll guide better future videos.